situation.
Thank you very much. Greg Stafford.
Thank you very much. Continuing on with the strikes, the cost of the July's industrial action was funded from existing NHS budgets. When Sir David was in front of us in September on strikes, he said, but bearing the cost of that being the strikes, would be beyond our ability to cope with. That would be unreasonable for the NHS to do and would have consequences on what we're able to provide. So how much central funding has been given to the NHS to cover the strikes, both in November and now?
Well, so far, not least thanks to the way that Jim and Elizabeth Omani, the Chief Financial Officer of the NHS, have managed with the system to keep costs under control this year. So far, we have managed to absorb pressures of strikes and costs of strikes without directly impacting on frontline services.
Is that correct, Sir Jim?
It is, yeah, so far. And as of this stage of the year financially, we are still broadly on plan. Elizabeth is in discussion with finance directors around the country about how we get some funding out into the system to recognise pressures so far, one of them being industrial action, but without also doing what's happened in previous years, where whatever the cost is, it gets settled up. But as Wes has said, there's no new money into the service that we're getting from Treasury or anywhere else, for understandable reasons. We've had to absorb it internally. We have managed that so far. But as I said last time, there'll come a point where it becomes unreasonable to expect that to happen, but the service has managed it really well so far.
But if money has been rightly saved in the NHS, that money's been spent on strike action rather than improved services. So essentially it has had an impact on frontline services because that money could have been spent on improving X, Y or Z.
There's an opportunity cost, absolutely. And that's why I think the strikes are actually ultimately self-defeating for the BMA and members of the BMA, not just... I know that the sense from BMA members reflected in the ballot, both in terms of turnout and the margin of the ballot response, is to give the government a good kick-in.
Yes,
but
sorry,
that does have an impact.
I do understand.
That does have an impact on the opportunity cost, as you suggest.
So therefore, going forward, given there are probably going to be more strikes, I hope there are you going to, Secretary of State, give a guarantee that in future the NHS won't have to find internal savings to cover these strikes?
We're going to have to keep the costs under careful review. I obviously talk to the Chancellor and the Prime Minister all the time about how we're managing the pressures in the NHS and the impact on services. So those will be ongoing discussions. As we can see across the board, and I think this is one of the points that needs to be considered in terms of the choices and trade-offs we make as a government. We are not awash as a country with cash. And I can't simply knock on the Chancellor's door and ask to access the reserve because it's not in abundance, and there are such a wide range of pressures on the public purse at the moment, on everything from the defence of the nation to crumbling public infrastructure through to the unavoidable unexpected, let alone something like this. And that is the context in which I've asked resident doctors as well as the wider NHS workforce to understand that as a government we're going as hard and as fast as we can to improve pay, terms and conditions and quality of services. Our job is made harder if we're locked in disputes and strike action that cost all of us, including doctors, because this does, as you've rightly pointed out, there's an opportunity cost of £500 million that has gone funding strikes that could have gone into funding a whole number of things that we and the BMA would agree on in terms of areas to make progress.
Thank you very much. Josh Fenton.